Hi guys, and welcome to the Heimlich maneuver. In this video we're going to learn how to save adults and children from choking. So let's start. Okay, so the first thing we should probably talk about is how do we recognize when someone is choking. There are a few ways. The first way is the story of the incident. So for example, if I am sitting in a restaurant and then someone suddenly stood up and started to gasp and he is restless, then that's a pretty good indicator that he is choking. It makes sense for someone to choke when he is eating in a restaurant. Another way is, as I said, if a person is gasping, then he is probably choking, okay? If a person is coughing, however, then he is not, okay? A person who is choking has a complete blockage in his airway. If a person is coughing really hard, then that means that his airway is not blocked, okay? A person who is choking will not be able to speak, he will not be able to breathe, and he will not be able to cough. Next is if we see that his neck muscles are really tight. If he is holding his neck like this, then that is a huge indicator, but that doesn't always happen. If we see that his face turns really red at first and then it turns into a bit more bluish. If he is restless, a person who is choking is not going to just sit down and be relaxed and quiet. He's going to panic, okay? If we see any of these signs, then that means that our patient is choking and we should perform the Heimlich maneuver on them. Now let's talk about how to perform the Heimlich maneuver. The way we do this is first, we want to tell our patient that we're going to perform it, okay? There's nothing worse than to go and hug a patient who is choking from behind while he's panicking and he's restless. You can get punched in the face if you do something like that. So first thing you should want to do is to tell your patient, hey, I know the Heimlich maneuver, I'm going to help you, don't worry. Okay? The next step would be to perform the Heimlich maneuver, which first let's talk about where do we perform it. The way we find the correct spot is we take our hand, our fingers, and we want to start feeling his chest, okay? Usually I start from the middle of the chest bone and I slowly go down while pressing. As soon as I feel a soft spot, right here I feel a soft spot, then that is where I want to press, okay? So it should be right below the chest bone, right here. Now, what I want to do is I want to do a fist with my hand and I want to put it right there. Next, I want to take my other hand and I want to wrap around the fist. Now, what I want to do is I want to really strongly press inwards and upwards, okay? And I want to make sure that I tilt him frontward a little bit, okay? And then I press again, inwards and upwards, inwards and upwards, inwards and upwards. I want to continue to do this until whatever is choking him will come out or until he passes out, okay? I will not stop until one of those two things happen. Now, a very important question to ask is, what do we do if it's a pregnant woman? In that case, we don't really want to press on the exact same spot where we pressed, which is right on the top of the belly. In that case, we just want to do it a tiny bit above the belly, okay? So if it's a bit on the chest, that's also fine. We will continue it there. And we will do exactly the same thing. We will tilt her a bit forward and we will press in and up, okay? Now, what do we do if it is a really fat person? If we can't really wrap our hands around a person, what do we do then? Well, if it is a fat person that we can wrap our hands around, then we will do the same as we do with a pregnant woman, and we will just press above the belly. But if we are tiny and we can't really wrap our hands around the person, then in that case, what we want to do is we want to make sure that we pin our patient to a wall, okay? And then we want to use, we can do, one second. I will put him down. Okay, and after we pinned our patient to the wall, we want to take our thumbs and we want to do this thing, okay? And we want to push in and up, okay? In and up. Now, if that doesn't work, we can also use our elbow and do the same thing. We want to push in and up on the right above the belly. No, sorry, on the exact spot where we want to do this, on the soft spot. And that is basically how we perform the Heimlich maneuver on adults. And this also works for children, okay? On children, we will do the exact same thing. And that is how we perform the Heimlich maneuver and save people from choking. Okay, and that is it for this video. I hope you enjoyed it, and I'll see you in the next one. Bye, guys.